The pharmaceutical industry is one of the most unaccountable parts of our economy that essentially makes its money by sitting on its monopoly position. It gets patents on the drugs that it makes. It then spends most of its time trying to extend those patents beyond the 20 years that it gets them for, trying to keep its data secret, so collaborative research is not possible. It is totally and utterly not fit for purpose. Coronavirus is the same type of virus as SARS was, another serious epidemic. That should have been a real wake-up call to begin researching drugs that could tackle an epidemic like this. But pharmaceutical companies don't benefit from epidemics. They benefit from people having chronic, long-term conditions that they can continue selling drugs to year after year after year. The research hasn't been done, which means the public sector, the governments, have to pour money, taxpayer money, into research at a time like this. The problem is they then hand over that research, or they collaborate in that research with the big pharmaceutical companies, and the big pharmaceutical companies get the patents off that research and end up charging an absolute fortune. Most people in the world will not be able to afford the vaccines that the big pharma ends up manufacturing with our public money because they will have patents on them. We need to make sure there are stringent conditions so that any medications that result from this are affordable, if not free. And it shouldn't just be free, of course, in the United States, but all the way around the world. For us here, we would have access to that vaccine because the NHS would pay the costs of those drugs. But that's still an unsustainable burden on the NHS, let alone many countries in Africa, for example, that don't have public health systems. People simply wouldn't be able to afford them. I mean, in America, the price that you can charge for medicines is based upon whatever the market will allow you to make. You can charge whatever you want, essentially. That can't be right. It's not a reasonable or rational way to run a healthcare system. Unfortunately, some of these rules are embedded in trade rules at an international level, in intellectual property rules at an international level. At the moment, our government is looking to sign a trade deal with the United States, and one of the main beneficiaries of that trade deal could well be big pharmaceutical corporations. Their interests are routinely pushed by American negotiators. And Trump himself has said, countries like us are freeloaders. We don't pay as much as we should be paying.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
So there's a real threat that that trade deal could give even more power to pharmaceutical corporations in this country. A lot of people say, well, hang on a minute, Big Pharma is researching drugs that we need as a society. They need to recoup the costs for researching those drugs, and therefore high prices, at least for a period of time, are reasonable. The problem is that's not really true. Between 1/3 and 2/3 of all medical research funds come from the public purse, and the amount tends to get higher depending on how experimental or early stage research is. Many people say, well, but the private sector takes risks. Actually, with medical research, we find quite the opposite to be the case. We find that the public sector is the bit of society that's taking risks. It's us that's taking risks. And yet, the biggest rewards go to those taking the least risks, i.e. the private corporations. The whole thing is upside down. So there's an awful lot of money going into research of these vaccines at the moment, but without the proper conditions, which state a company cannot simply take this research when we've collaborated with it and profiteer off it by putting patents on it. Why are those conditions not put on? I think you've got a real lack of political will here. Frankly, the governments are far too much in bed with the big pharmaceutical industry, and they pay too little attention to what we need as citizens. And it's really for us to speak out on this and absolutely demand that if our tax money is going to pay, quite rightly, for the research and development of potential coronavirus vaccine, that when that vaccine is produced, it will be delivered to us and to everybody who needs it in the world free of charge. The thing at the moment is big pharmaceutical corporations don't want their competitors, including public sector competitors, to be using the research that they've used to create their own treatments, to create their own drugs. And that massively hampers our ability to deal with the health threats that we face around the planet today. It's really important to have open source technologies because it allows different people to see what somebody else has created and build on that, build on those foundations and create something even better. In fact, our NHS, when it was first set up, that was one of the great benefits of it. It allowed that collaborative research. It allowed scientists to work together. And we're going to have to start thinking of ourselves far more as social animals than we have been trained to do by the economists and many politicians. We've had 30, 40 years of developing global rules for the way that the economy works, which are all about really helping the super rich, helping big business to get ever richer, to make more and more profit. We should have been developing global rules that help us create a more equal world that allows all of us to live good and dignified lives. And we could do that. Some kind of international pharmaceutical research and development under public control as part of an international cooperation on healthcare sounds like a good idea. The mainstream media has become more and more dominated by vested interests. That's why alternative media is so utterly vital if we're to create the kind of better world that most of us want to create, and it's why things like Double Down News are so important. So please, please, please support it if you possibly can.